PCOS Part 3. Unovulated follicles that are prevented from dissolving can become dangerous cysts.
Normally, you would develop one dominant follicle, and then that follicle ovulates and becomes what's called the corpus luteum, which then continues that pregnancy until it sees an HCG level, which is a pregnancy hormone, and that continues it.
Corpus luteum, a yellow hormone-secreting body in the female reproductive system, formed in an ovary at the follicle that has ovulated. It produces estrogens and progesterone. HCG, human chorionic gonadotropin hormone, produced by cells surrounding a growing embryo. This eventually forms the placenta. It can be detected as early as 1 week after fertilization.
But these other follicles, they should go through apoptosis, which is a programmed cell death. They go away, they're supposed to go away and kind of dissolve, the body dissolves them in. Similarly, that corpus luteum, which is the remnant of the sac of fluid that the egg was within, that will degrade and go away once that pregnancy is no longer there. It's an interesting process that when someone has PCOS and they don't have regular menstruation, the reason for that is because they don't ovulate regularly. And so that is the cause of oligomenorrhea, is that they aren't releasing that egg and then setting off that cascade of hormones to either go towards pregnancy or towards having a period. And that can get actually particularly dangerous if you have buildup of the uterine lining getting ready to get a pregnancy, and then people don't get pregnant, but that lining never gets the signal to shed. And that can eventually become a more dangerous process if it doesn't shed and doesn't shed and doesn't shed. Then those cells that are supposed to reproduce regularly can turn into even some precancer or cancer cells and things like that. So that's something that we always are very cognizant of, and it's because they don't have that ovulation and then that cascade of hormones telling a person to either get pregnant or to have a period once they have that.
So you'd mentioned that when one follicle ovulates, all the other follicles are destroyed through apoptosis, but they are, in the absence of the ovulation, all the follicles just sort of stick around wondering what to do with themselves. Is that right? And they become the cysts that are the prototypical definition of PCOS.
And also the unovulated dominant follicles can stick around as well. And so those ones, some of these ones that go through apoptosis really don't grow to be very large at all, but these dominant ones do, but then they don't ovulate. And so some of them are unovulated dominant follicles. We believe some of them are maybe other follicles that haven't gone through apoptosis.
And normally what the ovary is, I mean, could certainly fit in the palm of a hand, right? I mean, quite like the size of an egg, a little smaller.
A little smaller typically, yeah.
And then I remember where this ovary, the cystic ovary, was it was like the size of a kidney.
Some of them can get quite large. And that's just because the physics of a follicle taking up more space. And that stretch of the ovary people can feel that. That's why sometimes people have a ruptured cyst, and that can be painful. Often people go to the emergency room for something like that. People can feel also that ovulation even. Sometimes people can feel that.
Normally, a patient develops one dominant follicle, says Dr. Cole. That follicle ovulates and becomes the corpus luteum. That continues the pregnancy until it sees an HCG level, a pregnancy hormone, and then the process continues. Corpus luteum, a yellow hormone-secreting body in the female reproductive system, formed in an ovary at the follicle that has ovulated. It produces estrogens and progesterone. HCG, human chorionic gonadotropin hormone, produced by cells surrounding a growing embryo. This eventually forms the placenta. It can be detected as early as 1 week after fertilization. The other follicles should go through apoptosis, which is programmed cell death, and the body dissolves them. And the corpus luteum, which is the egg sac remnant, also dissolves. Dr. Cole continues, when someone has PCOS, polycystic ovary syndrome, they don't have regular menstruation. It is because they don't ovulate regularly. It is the cause of oligomenorrhea, infrequent menstruation, not releasing the egg and setting off the cascade of hormones in order to lead to pregnancy or toward having a period. It can become dangerous if there is a buildup of the uterine lining getting ready for pregnancy. Then, when there is no pregnancy, there's no signal to the lining to be shed over time. Cells can become precancerous or cancerous. Doctors are always cognizant of this danger. It is because the patient doesn't ovulate and have this cascade of hormones. This is often caused by insulin resistance. When one follicle ovulates, all the others normally are destroyed through apoptosis, but in the absence of ovulation, these just stick around and become the cysts in PCOS, and the unovulated dominant follicles stay as well. Normally, an ovary is smaller than a typical egg, but a cystic ovary can be the size of a kidney. Due to the cystic follicles taking up so much space, people can often feel this larger ovary, and it can become painful when the cyst ruptures.